Wonderful. Hi, welcome everyone. For those of you here live and those watching the recording afterwards, this is the Genetic Alliance Lessons from the Field series. Here with us today, we have two presenters, the first of which is Jon Florin, Executive Director at No Stomach for Cancer, and the second being Cheryl Walker, Genetic Counselor at Genome Medical. Jon will be presenting first. He joined NSFC in the spring of 2015. He comes from a diverse background in marketing and in customer service. His most important goal as the executive director is to bring stomach cancer to the forefront of the public view and increase the media's attention to the disease. This is no small task, as stomach cancer is often disregarded as a public health issue, although there are 1 million new cases diagnosed each year. Cheryl, our second speaker, is a board-certified genetic counselor with more than 6 years of experience counseling patients and families. Her primary area of expertise is hereditary cancer. So Jon, feel free to put up your slides and take it away. Questions, If there are any, we can hold.
No, and I don't have any slides, as a matter of fact.
Great.
I wanted this to be a lot of question and answer type of that would be my preferred format, would be to have a lot of questions and answers. But for, it looks like one person that we have confirmed here on the video call, I would like to say thank you for coming on board. And so as Matthew was saying, we are a stomach cancer advocacy organization based in Madison, Wisconsin. And we have been an organization now for over 10 years focusing on stomach cancer. And part of what we do, besides helping people through their journey from diagnosis to survivorship, is help them get help with genetic testing. We've found over the years that patients are often discouraged by their primary care providers from getting genetic testing, and that starts a whole slew of questions about the what, where, and why of genetic testing, and that's why we partnered with Genome Medical to hopefully break down some of those barriers and dispel the myths surrounding genetic testing, the need the need for it, or the argument against it. So that's where we are today, and why we wanted this meeting to take place. And looks like Mr. Lennon here has some interest in learning about the most relevant mutations associated with gastric cancer, so we can certainly talk about that. But I'm sure Cheryl has some more input regarding the importance of genetic testing for stomach cancer and why this program is important to the patient community. So Cheryl, if you want to kind of give your pitch, so to speak, and why Genome Medical does what they do for stomach cancer patients.
Sure. Thanks, Jon. And thank you for the introduction, Matthew. I do have some slides, so I'm going to attempt to share my screen, the correct screen. It's always the trick. So 1 moment. All right. Is everyone able to see my slides?
Yes.
Looks good. Okay, excellent. So as Matthew said, I'm Cheryl Walker. I'm one of the genetic counselors at Genome Medical. I've been a genetic counselor for some time now, and I actually learned about No Stomach for Cancer back in 2011, 2012, when the organization came to my genetic counseling program and presented, and I just found it fascinating. And I have a particular interest, something I don't share very often with people, is that my maternal grandfather actually passed away from stomach cancer at 23, so very early on. Not quite sure exactly how that happened, but it's always been an area of interest for me. So I'm very excited to be here today talking about Genome Medical genetic counseling testing. As Jon mentioned, try to address some of the myths and the truths around genetic testing. So a lot of the information I have is a little bit more general, but I certainly am happy to answer specific questions. I will definitely answer a question about genes and mutations related to stomach cancer. We'll get to that after I go through a couple slides, some information. So as Matthew mentioned, genetic counselor, my area of specialty and expertise is oncology, so cancer. So I focus on cancer genetics. I previously worked for a couple health systems in Dallas, Texas. Now I'm located in Pennsylvania. And I do all my genetic counseling now with Genome Medical remotely. So I talk with people by phone, by video, which is convenient for me, especially because of the pandemic, but also convenient for patients and families. It takes away a lot of the travel time and more convenience as far as appointments go. So very excited there. So next slide. So just to kind of go through general agenda of what we're going to talk about. For today, I wanted to first address, like John had mentioned, some of the myths and truths about genetic testing specifically, and then go into more information about the cost of genetic counseling and testing. That's always been a big topic. Billing for genetic testing. Things have changed a lot over time. So talking about what things are happening as far as currently with billing. Genetic counseling process at Genome Medical, kind of getting into what does that even look like? What is genetic counseling? Sometimes people have pictures or this idea in their mind that, you come into the office and then you lay down on this couch, kind of like what you may do in like a psychology or psychotherapy session, or, what people used to think about. It's not quite like that. So we'll get into some more of the specifics. And then, as John mentioned, doing some question and answer. If there's any questions, any kinds of whatsoever related to stomach cancer, genetic counseling, genetic testing, happy to address those at the end. So first, I have a little disclaimer, if I can get there. There we go. So this webinar, it's just constituting of general information about genetic testing and medical screening. So it's not offering or providing medical advice or diagnosis. Nothing in this webinar should be construed as such. Do not rely on the information from this webinar to make medical management decisions. Please consult with a medical professional before you make those decisions. Don't delay in seeking professional medical advice if you think you do have a medical concern. And do not disregard professional medical advice based on any information that's in this webinar today. So moving on, myths and truths about genetic testing. So first one, your genetic data. So one of the big myths out there is really surrounding what happens with your genetic information. So people have been very concerned, especially with, court case that happened a while ago, the Golden State Killer. How did they find him? How did they track that? Oh, they did it through genealogy. So people have been worried about and thought about, once you have genetic testing, your DNA must automatically be entered into some kind of government or national database that's accessible to a variety of different entities. That could include employers, insurance companies, law enforcement. Just anybody out there can get into this information, know all about you and your genetics. And the truth is that nothing like that actually exists. So your genetic information, like other health information that you provide to a healthcare provider, healthcare organization, it's private. So there's several laws that protect it. People may be familiar with HIPAA, the Health Information Portability and Accountability Act, and then GINA laws specific to genetic testing. So the Genetic Information Non-Discrimination Act. So both of those laws surround your protected health information, your genetic testing information. So you have access to your data. The genetic testing laboratory that does your testing has access, and your healthcare provider who orders the test. But there needs to be an explicit consent for any other parties to be involved. So nobody can just access the information without your permission to do so, which is important. So I know a lot of people are concerned, and people should be. There's been a lot of information with other, direct-to-consumer type testing laboratories, for example, where they are selling data. So, they more have I guess what they would consider a opt-out situation, where you are automatically opted in unless you explicitly say otherwise. And then they have permission, therefore, to sell your data to pharmaceutical companies or do whatever they'd like with it. So you do have to be careful. It's good to be concerned. It's good to have those questions. It's good to ask those questions if you're thinking about doing genetic testing and know where your information is going and how it's going to be used. So if you're sending it to a diagnostic genetic testing laboratory, so something that's ordered by a healthcare provider, those laws, HIPAA, GINA, they apply. Next one is wait time for an appointment. So this is, different areas of genetics have different wait times. Cancer, thankfully, most of the time, not too terrible, but it still can be a couple months for an appointment to see somebody in person. So the myth is that it could take weeks or months to be seen by a cancer genetic counselor. And usually in cancer, it happens a little faster. But every organization, hospital system, everybody's different. So that could still be the case for certain clinics or providers. So I don't want to make it seem like that's just never happening. At Genome Medical, because we do everything remotely, we do our appointments by phone, by video, we're able to schedule patients within usually about 48 hours of their desired time to have an appointment. But you could also certainly schedule later in the week, next week, several weeks later, over a holiday if you'd like, whatever your preference may be. So we do try to get people in very quickly. We have lots of availability. We have lots of genetic counselors, which really helps. And we can see people in all 50 states, which is also really helpful. Next one is access, convenience, and travel. So myth here is that appointments are always at inconvenient times. Genetic counselors are not in my geographic location, and I have to take time off work to go to an appointment, to travel to get to the appointment. And the truth is that could be true. Like I said, different clinics are functioning in different ways. They have different wait times. They have different situations, different structures. For Genome Medical, we have appointments just happening throughout the day because we have genetic counselors that are on the West Coast, East Coast, Central Time. We had somebody in Hawaii that was seeing patients a while back. So we have a lot of availability in different time zones and throughout the day. So a wide range of appointments are available. And we also have some evening and weekend appointments, which can be more convenient if you are trying not to schedule anything during the workday. The average length of an appointment is about 30 minutes long. So we really try to use your time effectively, use our time effectively, and focus really on how we can best help you in that time frame that we have, and be most productive during that time. So you meet with a genetic counselor either by phone or by video for the appointment. So no travel needed, as long as you have your phone or a laptop. That's all that's needed to be able to meet with your provider and get that information and access that data. Next one is genetic testing. So myth would be, if I have a genetic counseling appointment, I have to do genetic testing. And a lot of people really think that those go hand in hand. And we talk about these things often interchangeably, but they're actually two separate events. So genetic testing is very personal choice. Many factors go into that decision. The purpose of genetic counseling is really to discuss your situation, review key concepts about cancer syndromes, discuss the benefits and the limitations that exist with testing, and answer questions about the genetic testing process. But again, it's a personal choice. Not everybody who does genetic counseling ultimately goes on to do genetic testing. People make different decisions at different points in their lives, but you're always able to have a conversation, talk with a provider, talk through the ins and outs and get your questions answered. And I think that's really important. So two separate things. And then finally, cost of genetic testing. So again, this has been a big controversy, big issue for many, many years, because it did used to cost thousands and thousands of dollars. The myth is that people still believe that it costs thousands of dollars. Only those wealthy enough can access this information and benefit from this information. And the truth actually will lead us into our next session, which is cost of genetic counseling and testing. So cost of genetic counseling, let's tackle that first. So through Genome Medical, genetic counseling appointments can be billed to health insurance, just like any other kind of healthcare appointment. So you go see your doctor, you go see a nurse practitioner, whoever it may be, we can bill our appointments for genetic counseling to insurance as well. And we're in network with so many health insurance providers, always growing, millions of lives covered now. And on average, patients pay about $50 per visit. It can be less, more depending on insurance provider and the specifics there. People also have the option to self-pay for genetic counseling. So people could self-pay $179 for an appointment. And just not go through insurance, choose to go a different route. And then finally, there's other options. So financial assistance can be an option for certain people. A lot of times that's income-based, really just depends on the situation, but there can be things that we can do.
Yeah, and to add to the financial assistance part of it, and I think you might have a similar program internally, but is it referred to as a cascade testing, where after one family member tests positive for a pathogenic mutation, that subsequent family members get either a discount or free testing? Can you elaborate on that?
Sure. So that's offered through some of the laboratories.
Okay.
Some of the laboratories like Invitae and Ambry Genetics offer the cascade kind of testing. And I believe that we at Genome Medical have a discounted appointment cost with that. And then the cascade testing can be free as long as the testing is ordered with a certain time frame. So if a family member initially goes and gets tested through Ambry Genetics, finds out they have a mutation, other family members are interested in getting tested for that same mutation, they can have free testing as long as they do that within 90 days of the initial family member's report date. So that is available. Yeah, cascade testing, basically testing of family members for a mutation that's been identified. So yes.
Right, and then our financial assistance program that we have with the program with Genome Medical, which is if a patient can either bill their health insurance or get health insurance coverage or self-pay, then we will pay for the test.
Excellent. Thank you, John. Other thing that I wanted to note that I think is important is the cost of genetic counseling does not include the cost of any genetic testing. So just like if you were to go visit your doctor's office, the cost of that visit does not include the cost of any lab work or imaging that your doctor orders for you at that visit. So same kind of situation here. The genetic counseling appointment is separate billing wise from the genetic testing piece. So getting into the cost of genetic testing. So again, 3 options. Genetic testing can be billed to health insurance. So if a person meets their insurance provider's criteria for genetic testing coverage, which is what genetic counselors, one of our major things that we have to specialize in is knowing all the guidelines that are out there through the National Comprehensive Cancer Network, various other societies as far as who should consider genetic testing, who insurance is going to cover genetic testing for. That's part of our training and our continuing education around a lot of that. Just trying to make sure that we're making sure we're finding the right people, identifying the people that will benefit most from genetic testing, and insurance will cover that for them. When insurance is billed for genetic testing, people typically owe $100 or less. However, out-of-pocket cost is always dependent on current deductible status and other specifics with health insurance plans. So that's why we tend to see a lot of people in November and December get very busy because people have often met their deductible at that point and decide that that's the right time to do some genetic testing. So busy time, busy season. Other option is people can self-pay. So self-pay used to be $4,000 for about 2 genes 10 years ago. Now people can self-pay for genetic testing. It's about $250, $350 for hereditary cancer multi-gene testing. We often refer to this as panel testing. So things have changed a lot over time. Technology has greatly improved. The analysis methods, the time it takes to get the results. When panel testing first came out, it used to take about 6 months. Now it takes 2 to 3 weeks. So we have the ability to get information so much more quickly and have so much more information that's available. Third option is financial assistance. So some laboratories offer financial assistance, typically income dependent, that can help cover the cost or help with the cost. And as John mentioned, there's the cascade testing that some of the laboratories offer for family members. It's really just their way of trying to encourage people to get the information. Because unfortunately, a lot of times a mutation is found in a family and then no other family members ever get tested for that mutation. And the goal with genetic testing is to identify people who are at risk so that we can try and either prevent cancer from happening or catch it as early as possible. We want to change the disease course for people. And if we don't have anybody in the family who ultimately gets tested for that mutation that's been found, that's a huge missed opportunity. So that's just the laboratory's way of trying to encourage people to get the information to seek that out. So why consider genetic testing? So the main reasons that people will consider doing cancer genetic testing, if a person's been diagnosed with cancer, it's to try and better understand why did that happen. Cancer happens for a variety of reasons. Genetics is not the only reason by any stretch, but it certainly can be part of that. It can be a predisposition that a person's born with. So having a gene mutation increases lifetime risk. All these other factors, lifestyle, environment, age, those still factor in. But genetic testing can help give more information as to why a particular cancer happened for a person, particularly if it happens at a younger age. And potentially, if a person's had cancer or not, predict risk for developing future cancer. Trying to figure out, are they at risk for other cancers if they've already had one, or what's their risk in general for a cancer in their lifetime? Do they need to be taking different actions, screening earlier, more frequently? Second reason that people get tested, they want to figure out what risk looks like to relatives. So if they have any biological children, brothers, sisters, aunts, uncles, their parents, trying to figure out what relatives are at risk and who needs to consider screening. Again, trying to prevent cancer as much as possible. Third reason that people consider genetic testing is potentially they could have targeted therapy options. So there's different cancers. If there is a mutation present, certain therapies are more effective for people who have those gene mutations. So knowing that information can help guide what kind of treatment might be appropriate for that cancer type and be more effective for that person. So as far as the genetic counseling process at Genome Medical, what does that really look like? What are we talking about when we say genetic counseling? Again, it's not the couch in the psychologist's office. So genetic counseling is actually the process of helping people understand and adapt to the medical, psychological, and familial implications of the genetic contributions of disease. So as I mentioned earlier, genetic counseling can be independent of genetic testing. You're not required to proceed with genetic testing if you have a genetic counseling appointment, because again, genetic testing is personal choice, it involves multiple factors. So when I talk about, genetic testing and go through all this information, I'm talking with patients about their particular situation. So genetic counseling and testing is essentially personalized medicine, which gets us here. So precision medicine, that is patient-centered. So at Genome Medical, everything that's done revolves around the patient. So there's a comprehensive care team, includes genetic counselors, includes medical geneticists, pharmacists, primary care providers. We have care coordinators. Everybody's working together to give the best care, to provide the care that's needed for our patients. So cancer genetic counseling appointments specifically, before the appointment would happen, it would need to be scheduled. So a person could schedule with a provider, they could do that online, self-schedule. They could schedule via live chat on the website, call the main line, schedule by phone, or they could email and get scheduled with one of our care coordinators. And then typically a survey will be sent, like a little questionnaire, has a couple questions just asking about what family history looks like, if that person's ever had cancer, gathering a little bit of information before the appointment, because that really helps tailor the session, helps us as genetic counselors prepare and have the information needed. And you can ask specific questions so that we know that we need to address those during the session. And then during the appointment, we want to discuss our goals for the session. So genetic counselor wants to tailor the appointment to you and your concerns. So together you come up with goals, review personal medical history, family history, review risk information, talk about how mutations are inherited, discuss options for testing and billing, and then review those laws that I mentioned earlier that talk about genetic discrimination, and then plan for how results, if you order testing, will be communicated to you after the appointment. And then after you have your appointment, you typically will receive a summary clinic note, summary letter. The testing will be ordered by provider. So if testing is wanted, desired, we'll order it. And then the provider will disclose the results once they're available and discuss the implications. So we send a copy of the test results, summary letter. Patients might have another appointment to discuss those, or they might not, just depends on the situation, their schedule. But they will receive their copy of their test results, final summary letter. They might get other information too. So if a mutation's found, they might get information about support groups or family letter to share with relatives to encourage them to get more information about this mutation, consider testing. For a particular cancer type, they might get clinical trials or research studies that might be beneficial or of interest. And then with Genome Medical, people get us little short survey, 4 questions, just asking about their experience so we can capture some of that information, see how we're doing. So our goal is really to support people throughout their lifetime. So throughout their genomic journey, as we're calling it. So from birth to later in life, we have genetic areas that and genetic testing that can happen at different points in the lifespan, whether it's pediatrics, looking at kids and trying to figure out what might be going on for them, family planning, risk assessment, could be cancer, cardiac, pharmacogenomic testing. All of that is information that we are able to talk about with patients, give them information about genetics, and answer questions they might have. So we want to be able to take care of people throughout their lifespan. And so at Genome Medical, there's more than 60 clinicians that we have on staff. They average 10 years of experience. We have, like I said, services in all 50 states, and then 48 hours is usually a typical time frame where we're able to see patients. And we have experts that are in cancer, like me, cardiovascular genetic testing. There's proactive testing now, so healthy individuals who are just interested in learning a bit more about what they might carry as far as genetic disease, something that maybe hasn't presented but could present sometime in adulthood, could be affecting them, their children. Reproductive genetic testing, there's pediatric, and then pharmaceutical, so pharmacogenomic testing, figuring out how drugs are metabolized. So if people are interested in learning more, discussing any information from the webinar, if there's any concerns about hereditary cancer based on your history or your family history, or maybe you have a different genetic concern, people can schedule an appointment and learn more. So you can visit genomemedical.com or can call that main line, the 877-688-0992 number, and somebody be happy to help. And that's all that I had for my slides. Anything that you wanted to jump in and say, John?
No, I don't. Honestly, I think we covered pretty much all the different aspects of genetic testing that all the different questions, the immediate questions that one would have. So I would leave it open to discussion at this point for our visitor. I know this is being recorded, so that's good, because we were all expecting more people, because quite a few people did register. But if Mr. Lennon wants to ask some questions, feel free. Are you still there, Mr. Lennon?
Maybe he's trying to unmute. I can send him a message. In the interim, I did have one question. I'm actually familiar with the answer, but I think it's a common question that I've heard on my end. And Cheryl, this would be more directed at you. I think it would be kind of a myth versus fact question. And it was, a lot of people do make that comparison, like you said, to like a psychiatrist or psychologist visit. They get on the couch, they sit and talk. Similarly, a lot of people think or wonder whether or not you can get everything done in one visit with genetic counselor. It's one of those things that you're going to need to do multiple visits. Would you be able to address that? I know you talked a little bit at the end when you were talking about what happens in your appointment, but yeah, I think that.
Yeah, no, that's a great question, Matthew. And usually, in cancer specifically, as far as that area of genetics, we typically will see people for 1, possibly 2 appointments. So they'll usually have an initial appointment where we talk through all those things that I mentioned, and order testing potentially for them. If we do order testing, get those results back, they'll often have a follow-up appointment, like a results disclosure kind of appointment, where we talk through those results. What do they mean? People always think, oh, well, positive results, that's really where you need to have an appointment to discuss those. But people can have just as many questions if they have negative test results. They might be expecting to be positive or hoping that they might be positive, because that might qualify them for a certain medication that may be more effective for their cancer treatment. So they might have just as many questions or even more with negative test results versus positive. So typically we're seeing people for an initial visit and possibly a results discussion visit. But for other areas of genetics, like pediatric, if you have a child that's born with different anomalies or birth defects or just have different symptoms, not meeting milestones, that family might meet with their genetic counselor every year to just check in and see what's going on. And they might meet with genetic counselor and a medical geneticist who will kind of work together and maybe order different labs or imaging or whatever may be needed. So different areas can certainly operate in different ways, but for cancer, usually it's just 1 or 2 appointments. I unfortunately don't have the opportunity to see people longer term. So I do like when I see people again, if they have questions or anything like that, always happy to see patients come back and answer any questions that they have, but it's usually more of a short-term kind of appointment, not an ongoing session.
Thank you so much, Joel. I see Mr. Lennon has unmuted. Feel free to ask your question.
Sure. How are you doing? Cheryl and John, thank you for the presentation. First question is really about a follow-on from Matthew's, which is, especially when there are mutations of somewhat unclear significance, even if, are variants of uncertain significance, how do you see currently the best ways for patients to track findings over time, so that if there's a research finding a year from now, 5 years from now, that either impacts, the predicted outcome of their disease process or their therapies, that they'll be notified and updated about that? I mean, it's clearly not simply Genome Medical's responsibility, but somehow we all have to together keep track of people and their mutations over time. I know groups like My Gene Council certainly have one approach. I'm curious on your take to, how are we grappling with this going forward? What are the best ways?
Sure, I think that's a great question, Mr. Lennon. I don't know that I have a perfect answer. I know at Genome Medical, what we're doing is we get, if there's patients that have variants of uncertain significance results, any updates in classification, those get sent to us, and then we reach back out to patients and notify them, make sure that they get that information, that updated summary letter, updated test report. So at this point, really, any kind of updates to genetic testing results are going to the ordering providers. So, that's always tough if, a person is seeing their doctor at a local hospital and then they move and they're suddenly no longer in contact with that doctor is the one who ordered their genetic testing. Unless they know to check in with that doctor or reach out, they may not get any kind of updates. So I think that it's an imperfect system right now. And I don't know that patients can request. Laboratories have gotten better about releasing results directly to patients. It is their information, it's their testing. There's different laws and such that govern these in each state. But I don't know still if they're able to release variant reclassification results directly to patients. But I think that would be the ideal way to go about it. Ideally, they would also have people that could be talking with those patients about their reclassified results, particularly if they're positive. Most in cancer get downgraded, get reclassified to negative. But particularly for patients that were found to be positive, their variant went the other direction towards being a mutation. They really need some support. There needs to be some kind of professionals in place to help those patients understand those results and get them plugged in with their provider who ordered the testing, or a new provider if they're in a different place or different situation at that point. I think certain studies like PROMPT might give information about reclassification or keep patients up to date. I don't know for sure. And I know sometimes patients want to research on their own. Some people are very savvy. I will direct them sometimes to ClinVar and CBI's database so that they can do their own searching if they would like, if they are particularly savvy in that area. But I don't think there's a perfect way at this point for reclassification, for any updates in genetic test results to be communicated to a patient. I'm not sure what my gene council is doing, but
one additional thought beyond variant reclassification, especially for VUSs. I'm a member of the ClinGen actionability group, a working group that is, we're often finding or changing a guideline. Sure. And the ways in which the updated guidelines are propagated through the community are really unpredictable and sporadic. And, it's a long, unfortunate, bumpy road between an update we provide and a patient learning about it. That's really unfortunate.
It is unfortunate. Yes. Yeah. And we as providers try to stay up to date on guidelines, but I still haven't found a very good way for NCCN to even send me an email when they update certain guidelines.
Let me follow on with a question for both of you. I actually was participating earlier today in a UK Biobank symposium. And, as often is the case, I think for those of us in the United States, we sometimes have quite a bit of envy over healthcare systems that are centralized, nationalized, and where, there's large scale efforts to pull together data in really fascinating ways. And they're just doing a fantastic job. And as today, they announced the release of 200,000 whole genomes and a whole variety of findings with that. Do you, either of you, see particular prospects here within the US, as you compare to outside what's happening internationally in the field of stomach and related, neoplasms? Do you see things that we might want to copy that are being done outside the US that, we should consider?
Do you want to go first, John? I don't know if you have anything you want to contribute there.
No, why don't you? I would probably defer to you on that question.
I don't know that I have a good answer for that one either. I know that, like you said, if there's a more centralized healthcare system, national health system like the UK has, it's much easier to get information, do those kind of biobanking activities and get data. The US struggles in that area because it's up to different independent health systems or different organizations to try and do that. I don't know of anything specifically that we'd like to emulate, but I'm sure there's definitely information out there and systems out there that we'd like to try and leverage and use to our benefit here and try to take some of those ideas and use them. But I don't have any specific kind of knowledge or ideas at this point.
Well, and then if I can follow on with one last thought, I'm curious if either of you have seen any significant advances in the use of effectively chatbots or artificial intelligence aided educational and outreach systems in the genome counseling or genetic counseling realm relevant to these types of cancers. You know, there are plenty of people who do have questions and want to learn about whether it's Lynch syndrome or Li-Fraumeni or, you know, other areas that might have relevance to some cancers. And they can't always or don't choose to immediately go, you know, to the high road, let's say, to genetic counseling with its associated costs, but they might be willing to, you know, go online and answer a few questions to a chatbot or something equivalent. Do you see advances in that area that, you know, are recommended or at least that you find promising?
Definitely. So in the last couple of years, especially AI and chatbots, that's been a huge topic of conversation in genetic counseling at our national meetings and other meetings surrounding genetic counseling and testing. I know that different laboratories have developed their own AI kind of systems, their own chatbot. One I'm most familiar with or heard most about was Gia from Invitae. But so many different health systems have been creating their own videos or chatbots or similar kind of technology-enabled solutions to try and help patients just get that general information. You know, some of the information that we cover in every genetic counseling session is very much the same. Like we always want to talk about those laws that protect people who do genetic testing. We want to talk about GINA, the Genetic Information Non-Discrimination Act. Could we get that information about possible test results, that kind of stuff to a patient before they have an appointment, or maybe they're just considering an appointment, like you said. So yes, I think that that's a huge area that people are exploring. They're trying to figure out what's the best way, how do we do this? Unfortunately, a lot of it's targeted for like hereditary breast and ovarian cancer, BRCA mutations, or Lynch syndrome at this point. They don't necessarily address stomach cancer specifically or rare tumors like paragangliomas or pheochromocytomas. Those are kind of left out of the conversation as they're trying to just figure out how to best do this for these like big hitter type syndromes. But it's definitely an area that's growing, and it's definitely an area that a lot of organizations are considering how they can leverage technology to help get to those patients and meet them where they're at and get them the information so that at least they have some background knowledge when they go for genetic counseling or just in general so that they can figure out where to go and what to do.
Jon, is that something that your organization is considering or has considered?
Absolutely. I mean, we've looked at all kinds of different things, and our challenge is always, you know, finding the right partner and then of course finding the funding to execute a program like that. And so at this point in our development, and even a lot of the other stomach cancer groups, is we're all heavily focused on funding research, just general basic and translational research, which, you know, obviously diverts our attention away from these things. But if you do have, you know, we continually look to the community outside of our own, including individuals like yourself, to help guide us and give us some ideas about, you know, some of these other things that we can be doing outside of the clinical setting. And I would certainly be open to any of your thoughts or ideas or ways that we might be able to do some of these things.
Great, thanks.
Thank you so much for your question. So it was great and definitely generated some great conversation and topics.
Very thoughtful questions. I think that somebody, I don't know who had asked, something about mutations for genes of stomach cancer. I'm not sure. I feel like that came up at the beginning. But as far as the genes specifically related with stomach cancer, CDH1 is a big one as far as diffuse gastric stomach cancer. More recently, CTNNA1 is a gene that we know has been associated with stomach cancer. The risks are still less clear, but there definitely seems to be association, and more research is continuing with that gene specifically. And then we know that Lynch syndrome, so mutations in the MLH1, MSH2, MSH6, PMS2, EpCAM genes can cause increased risk for stomach cancer. Perhaps there will be more that we learn about as time goes on. Things have changed so much, in the last 20 years with genetic testing. Like I mentioned, costs has come down, technology's improved, the number of genes we can analyze has increased. So there's probably others, but that's really the big hitters at this time.
Right.
Thanks for addressing that. I do remember, I think John made a comment earlier on about that. I'd forgotten. Thanks so much, John.
No, it's fine.
Let's see. I don't know if we're gonna have any other questions, just any thoughts or build up on there.
But yeah, to Mr. Lennon, to I'll send you my email, and you can email me directly, and we can keep the conversation going. And we are always open to ideas, and we are an efficient and nimble organization. We don't necessarily have a lot of bureaucracy or red tape that we have to go through internally to make things happen. It really comes down to timing, the amount of time it takes to execute a program, and then of course the funding that may be required.
Thanks so much, John. That leads in perfectly. I want to give you both an opportunity just to make very clear to either our attendees or the viewers watching the recording, what's the best way to get in contact with either you or find more information about your org? So Cheryl, in your case, how would someone come to make an appointment with Genome Medical if they were interested in that? Or John, how would they get in touch too?
Yeah, if someone is interested in our program with Genome Medical for stomach cancer genetic testing, there is a prominent link on our homepage now, right below our main image for our genetic testing program. And if you just click through that, you can follow the steps and receive your consultation.
Right, so that would be the No Stomach for Cancer main page.
Yes, the main website, you bet.
Yeah, and then if somebody wants to schedule a different way through Genome Medical, either way is fine. People can go online to www.genomemedical.com. They can live chat on there. They can self-schedule on there. They can call our main line 877-688-0992 and schedule with our care coordinators, or they can email clinical@genomemedical.com and get scheduled that way. And if anybody has any questions or just wants to reach out to me personally, my email address is my first name, Cheryl, SHERYL, @genomemedical.com. And I'm happy to answer questions, or people can reach out. I'm happy to hear from anybody. So.
Thank you so much, Cheryl. That's absolutely wonderful.
Thank you.
With that, I will say that this concludes this Lessons from the Field webinar. Everyone who signed up and recorded will be able to receive the link to this recording, or viewing the recording, receive the link to this recording, also receive more information about our future Lessons from the Field webinars put on by Genetic Alliance. So I'll go ahead and stop the recording now.